Crohn's disease is a chronic inflammatory disease of the intestines, which can break down the lining along the large and small intestines.
It affects nearly 2 million people in this country, men and women equally. And tonight, WXII 12's Craig Thomas shares his personal journey battling Crohn's disease.
Crohn's disease and colitis are diseases in your intestines. They are treatable, but there is no cure, and they can be brutal at times to deal with. Over 1 million people in this country have these diseases, and I'm one of them. I've been dealing with Crohn's disease for 5 years. Crohn's disease is an embarrassing disease. When your disease is active, you might go to the bathroom 5, 10, even 15 times in a day. From the time I was a little boy, the word diarrhea was the yuckiest word in the entire dictionary. The kind of word that either you whispered because you didn't want to say it out loud, or you said so loudly so that everybody would laugh. So people who are dealing with this don't like to talk about it.
This oftentimes is a barrier to patients coming to see their doctor or even discussing the disease with their loved ones. But it's important that patients go to see their doctors early because early treatment is key to getting the disease under control quickly.
Jason Conway is my doctor at Wake Forest University Baptist Medical Center. My first year with the disease was pretty rough. I lost about 20 pounds because when you are sick, you can only eat a very bland diet. I had anemia, I had a B12 deficiency. I did have to go to the hospital for a weekend because I had a small obstruction. And then for the next three and a half years, I was pretty healthy. And this June, I was doing great. I was doing well personally. I was doing well professionally, I think. I was in such good shape that I even did a boxing piece for this station. And then suddenly, I was miserable. I had severe pain, severe cramps in my gut.
This is a CAT scan of your CT when you first had your flare. This area right here in white represents the fistula that had formed between two loops of your small intestine. In that fistula is a small area of infection.
The next month was one of the worst times in my life. Since I couldn't eat, I had no energy. And the worst thing was I couldn't sleep. I would put ice on my gut and try to take the pain away, but I would just look at the clock roll by, twist and turn, and things got so bad that I would sing to myself in the middle of the night to try to go to sleep. And I have an absolutely horrendous voice. There were times when I didn't think I could go to work the next day. I didn't think I'd be able to ever get better.
When patients are having severe symptoms as you were, they can certainly start to feel very down about their disease. But the thing to keep in mind is that our treatments now have come really a long way, and we have some very effective medicines to be able to take people from being as sick as you were to within really even just a few weeks, getting you nearly back to normal.
And that's exactly what happened. My infections went away. I kept taking the daily doses of my usual medicines and added a new medicine. It's called a biological agent and wasn't even available a couple of years ago. So every 2 weeks, I take a needle like this, I go like this, and the medicines are beating the disease. So there is hope, and that's why I'm telling my story. I want to raise awareness about the disease, and I also want people who have the disease to know there are lots of people out there who have it, including someone like me.
Craig, I knew you were going through some pain, but I had no idea that it was this intense. But I do remember the day that you got the order for the medicine and how excited you were. How difficult was it for you to share this story?
Well, it's embarrassing, and it's yesterday I had a nervous moment saying maybe I shouldn't do it when we were editing it all together. But the fact is, when you're on TV, you do get an opportunity to, be out there a little bit, and it really is a disease that needs to be gotten out there as much as possible, just because so many people who might have it don't want to talk about it. So it's tough, but you have to do it.
We're pretty close friends, and when you were going through all that terrible pain, we talked about it a lot. For the folks who may be dealing with this, what got you through that period of time?
Talking about it, because the first time I was really sick in Syracuse, I didn't talk to anyone about it. I was in a cocoon almost, and it was so bad. And because you feel like you're your friends, your parents, your girlfriend, whoever doesn't want to hear about it. But this summer, when I was sick, I told you guys how excited I was when I got my medicine. I called my friends, when I was feeling awful. I have one friend who makes me laugh all the time. I called him. I was like, all right, man, I'm miserable. Make me laugh right now. Mm-hmm. And so that is how, because you need to feel the people who care about you, especially when you're not so happy yourself.
And I think by you talking about it, you're going to help a lot of people out there who may be dealing with the same thing.
Let's hope.
Now, for more information, go to the Crohn's and Colitis Foundation of America website. It's ccfa.org, and there are support groups locally.
One of them meets the second Tuesday of every month at St. Timothy's Episcopal Church in Winston-Salem at 6:30 in the evening.